Our goal has to be not about any particular program or any particular way of doing things. It has to be, how do we get health care to people better, faster, and cheaper? Better, faster, cheaper. These are social, moral goals. Even the cheaper. If you are spending too much money getting health care to people, you are able to serve fewer people. You are straining the economy. Why is it such a big question? Can we pay for all Americans to have health care? Because we spend so much money on it. That's why. If we could figure out how to do it cheaper, it would be a trivial problem. Now, is Minnesota like a terrible place to have medical things done to you? All right. Have you heard of the Mayo Clinic? What if we all modeled Minnesota? What would the savings across the country be? Well, about 30%. Now, keep in mind, this is old data. I mean, this is like 1990s, early 2000s. So we're looking at the way, we're not looking at some whiz-bang new way of doing medical care. We're talking about the way we've always done medical care. Some ways, some places do more, some places do less. And it turns out the places that do less, you're no worse off. So you could save 30% if we all modeled the way it's done in the least expensive areas with no drop in quality. In fact, there would be an increase in quality. It's estimated some 30,000 people a year are killed by unnecessary procedures. You save 30,000 lives right off the bat. Now, how much is 30%? Well, in 2008, it is projected we're going to spend 2.4, you see that T? That's trillion. An unimaginable, mind-boggling big number, right? 30% of $2.4 trillion is $720 billion. I think that needs to be written a little bit bigger. 720 billion dollars. Now, if we could somehow salvage that out of our system, could we pay for every American to have health care? I think it's about 7 times what we might need. In fact, some healthcare economists allege that it actually won't cost that much to cover all Americans because, in fact, we already take care of these people. We just take care of them in the ER when they come in diabetic shock instead of taking care of their diabetes ahead of time. So actually, it might cost less if we took care of everybody. How do we get there from here? Do we order the docs, do it this way? Do we have a standardized system? Everybody's got to do it the same way? Well, there's several things wrong with that. One is that doesn't sound very much like doctors. The second one is it's not very American. We don't do things that way. But the third thing is we don't know what it is that they're doing different in Minnesota. We don't have the data yet to figure out what's different. So how do we get there from here? It's not by some kind of huge government fiat. It's by a very simple thing. We have this belief in America, which I've mentioned several times. It's probably the most widely shared belief in America, which is you get what you pay for. Well, in order to feel like you're getting what you pay for, you have to know what you're getting, and you have to know what you're paying. And on both ends, in healthcare, we have no idea.